Hello, everyone. Welcome to the webinar, Sun Protection and Sunburn Among U.S. Older Adults. The webinar is being recorded and will be posted on the GSA website. A notice to all attendees will be distributed once the recording is available. A question and answer session will immediately follow the live presentation. We will be accepting questions through the questions feature that's accessible on the GoToWebinar panel. Also located there is a downloadable copy of the presentation slides. Our speaker is Dr. Don Holman, behavioral scientist in the Epidemiology and Applied Research Branch of the Centers for Disease Control and Prevention, Division of Cancer Prevention and Control. Thank you, Don, for bringing us this important program.
Thank you so much, Judy. And a quick tech question. I was able to move the slides myself earlier. I wonder if you need to make me presenter again?
Let's see here. It looks like, let's just jiggle this button a bit and then see if that works, if I do that.
Okay, here we go. It's prompting me to show my screen. I bet that worked. Yes, okay. Well, thanks again, Judy. And also thank you to GSA for the opportunity to share this work. As Judy mentioned, my presentation today will focus on sun protection and sunburn, specifically among U.S. older adults. This presentation is based on a paper that was published in the Gerontologist, and I'll be hitting the highlights. Of course, additional details are available in the paper itself, and I've provided the DOI link if you'd like to go check it out. This paper was actually one of 11 papers published in a supplemental issue of the journal, which was sponsored by CDC's Division of Cancer Prevention and Control, and all of the papers are free to view online, and there's a link in this slide to that supplement. As I start, I'm going to start off with some general background and some high-level statistics about skin cancer for those who are less familiar. We know that nearly 5 million adults are treated for skin cancer each year at a cost of over $8 billion in treatment costs. Annual spending on skin cancer treatment has been increasing rapidly, but there's really good news here in that we know skin cancer can often be prevented by avoiding overexposure to UV radiation. Basal and squamous cell carcinomas are the two most common skin cancer types. They're usually treatable, but they can be costly to treat, and especially if someone's frequently having these diagnosed, treatment can happen quite frequently, and it can leave behind scarring. Melanoma is the third most common skin cancer type, but it causes the most skin cancer-related deaths. And this is because if it's not caught early, unfortunately, it often metastasizes to other parts of the body, including vital organs. Now, anyone can get skin cancer, but people with certain risk factors are more likely to get it. This includes people with fair skin, light hair, and light eyes, skin that has a tendency to sunburn easily or develop freckles, those who have a large number of moles or certain types of moles, and of course, people who have either a family history or even a personal history of skin cancer. Risk is also highly associated with age and sex. So as you'll see in some data I'm going to show in a moment, as people get older, their likelihood of a skin cancer diagnosis increases dramatically. And in those older age groups in particular, we notice a difference between men and women, where men are more likely to get skin cancer than women. So of course, these risk factors generally can't be changed. There's not a lot we can do about them directly, but we know that a great way to lower your risk is to reduce your overall UV exposure and avoid getting sunburn. Now, that being said, of course, we know there are a lot of benefits to spending time outdoors. So we generally encourage people to enjoy time outdoors, but to do so safely by using some of these sun safety strategies. These strategies work best when they're used in combination. I think a lot of times when people think about sun safety, their mind immediately goes to sunscreen. And that's certainly an important tool in our toolbox of sun safety strategies, but These strategies work best if they're combined, and that's how you'll make sure you're adequately protected. So we encourage the use of protective clothing like long sleeve shirts, pants, skirts, and other clothing that goes to the ankles, wide brimmed hats to cover not only the face, but also the ears and the back of the neck, sunglasses to protect your eyes and the delicate skin around your eyes, and then as much as possible when spending time outdoors, seeking out shade and staying in the shade for protection. I'll also mention UV tends to be most intense during midday, from about 10 in the morning till roughly 4 in the afternoon. And so if you can reschedule outdoor activities to avoid peak UV times, that can also really help to reduce total UV exposure. So next, I'm going to give a quick overview of some of our melanoma data. One thing I want to mention briefly is that for most cancers, including melanomas, when they get diagnosed, they are required to be reported to the state's central cancer registry. Now, this is not the case for basal cell carcinomas and squamous cell carcinomas because they're just so common that typically they don't get reported and they're not required to be reported. But melanoma is, and so for that reason, we have some really nice national data on melanoma incidence in the US. And I'll just be walking you through a little bit of this because I think you'll see it really points to the need to be expanding our conversation about sun safety and skin cancer prevention to include older adults. So as you can see here with this graph, this is showing incidence rates of new melanoma cases by age group, and incidence rates, as you can see, increase dramatically as we get into those older age groups. Here I've got melanoma incidence rates broken down by males and females and then by racial and ethnic groups. So clearly whites are at a greater risk for melanoma compared to other racial and ethnic groups. And particularly if you compare white males to white females, you can see that males are at an increased risk compared to females. Now, this next slide really drives it home, I think, because this is only looking at melanoma incidence rates among non-Hispanic whites, so the racial ethnic group where we see the highest incidence rates, and it's broken down not only by age group, but also by sex. And this is where you can see for males that relationship between age and incidence rates is so strong, and we see such a high rate of melanoma among older non-Hispanic white males. And for females, certainly risk continues to increase with age, but at a much slower increase, so to speak. This is basically a visual abstract from a paper we published last year looking again at melanoma incidence rates specifically among non-Hispanic whites. And we wanted to look at trends and changes in incidence rates over time. The reason I wanted to share this is, again, highlighting the importance of including older adults in our conversations about skin cancer prevention, because as you can see here, most melanomas are being diagnosed in people over the age of 55, and that age group is really where we're seeing an increase in incidence rates. Whereas for younger adults, at times we've actually seen a slight decrease in incidence rates in recent years. Now, as I mentioned, basal cell carcinomas and squamous cell carcinomas are generally not reported to central cancer registries. So we end up relying mostly on medical claims data for information about those cancers. These are some images and bullet points from a paper that was published by Rogers et al. In JAMA Dermatology a few years back. And it basically highlights that similar trends are happening in these non-melanoma skin cancers. So we're seeing that risk for these non-melanoma skin cancers increases with age, and the total number of procedures to treat these skin cancers has increased with time. So we know skin cancer is a major public health problem in our country and that it predominantly affects older adults. But the question still remains, does sun exposure in older adulthood really matter? And that's at the core of our paper. There really hasn't been a lot of research to address this specific question, but this slide outlines some reasons why I think it probably does matter, that our sun exposure later in life does matter. First of all, older adults tend to be more susceptible to UV damage, and this is for a couple main reasons. One, there are some age-related changes that happen in the skin that make older adult skin more susceptible to sun damage. And then older adults are more likely to be using certain prescription medications as well as certain topical products that can increase their sun sensitivity. We also know that sunburn at any age increases skin cancer risk. And this counters some misconceptions that have circulated in the past about most of our sun damage and most of our risks happening early in life. But what we've learned is it's not just the first couple decades of life, but it's sun exposure throughout adulthood that matters. There was a meta-analysis done by Dennis et al. That was published in 2008. And even though it's getting a little bit old, I think the results really still are very relevant and should be considered in our thoughts about older adults and sun protection. They looked at all the research that had examined the association between sunburn and risk for melanoma, and they looked specifically at what age the sunburn happened and at what life stage. And what they found is even into adulthood, getting a sunburn increased a person's chances of developing melanoma. The other thing to point out is that adults are living longer. So an adult today who reaches the age of 65 can expect on average to have another 2 decades of life. And I think those are 2 additional decades that provide opportunities for skin cancers to develop. So if we can delay that process a bit, kick that can down the road, so to speak, we might be able to help people avoid treatment for some of these skin cancers later in life. So for our paper, our hypothesis was that regular use of sun protection would be associated with a decreased likelihood of experiencing sunburn. And we looked at 3 specific types or categories of sun protection. One was sun avoidance, and this included staying in the shade, as well as people who said they generally don't go out in the sun. The second category was protective clothing, and this included wearing wide-brimmed hats, wearing long-sleeve shirts, and wearing clothing that goes down to the ankles, like long skirts or pants. Sunscreen, we consider its own category, and we organized these into 3 categories because we really saw them as slightly different types of behavior. We used data from the National Health Interview Survey, which is an annual cross-sectional household interview survey. It's a nationally representative sample of the US non-institutionalized civilian population, and weighted proportions are used, which allow us to reflect the national population. This is the conceptual framework that underlies the study. It reflects the idea that sun protection behaviors are influenced by a number of these demographic characteristics. And based on past research findings, we also thought it was especially important to capture respondent sun sensitivity. We measured this by a question asking respondents about how their skin reacts to 1 hour of unprotected sun exposure. And essentially, if a respondent said their skin would burn, whether it was just a mild burn and then would turn into a tan, or a severe burn with blisters, if they told us their skin would burn at all, then we coded them as having sun-sensitive skin. We measured sunburn by asking about how many sunburns respondents had had in the past 12 months. And then we measured sun protection behaviors by asking participants how often they used each of these sun protection strategies. And this was specifically in the context of when they're outside on a warm, sunny day for an hour or more. So making it very clear that this is a context in which we would encourage sun protection to be used. Those who reported using these protective measures always or most of the time were coded as regularly using that form of sun protection. There were over 7,000 respondents in our final sample that were over the age of 65. So we were able to include them in our analyses focused on older adults. We excluded respondents with a personal history of melanoma and those that had missing responses to the questions about sun protection and sunburn. So here's a quick snapshot of some of the demographic characteristics. Just over half were women, nearly 80% were non-Hispanic white, most were born in the United States, and just under half told us they had sun-sensitive skin, meaning that they would burn after an hour of unprotected sun exposure. On the right, you can see the age breakdown, and while nearly half were in that age range of 65 to 74, we did have about 1 in 10 who were in that 85 plus age group. So we had a really nice age span within our sample. Now, the next few slides I show you will depict the percentage of older adults who reported regular sun protection. But I'm going to show it to you in a number of different ways. So this first slide is breaking it down by individual sun protection behaviors. And you can see here that among men, wearing long clothing to the ankles, likely pants, was the most frequently reported sun protection behavior. And among women, staying in the shade was the most frequently reported sun protection behavior. And taking a look at some of these differences by sex in the sun protection behaviors that are used most can be helpful as we're thinking about what strategies would be most acceptable and most palatable to the target audience when we're thinking more about messaging and communication. One thing I did want to mention, that last category, don't go out in the sun. So that we didn't have a specific question about that behavior, but what we found, and we've seen this in past surveys too, is that sometimes when respondents were asked how often they used a sun protection behavior, they would not respond with one of the response options, but would rather say, I don't really go out in the sun, or I don't go out in the sun for an hour. That's not something I do. And so we wanted to capture that as its own sun protection strategy. So you can hear there were a small number of respondents who said that. So on this next slide, you can see the total number of sun protection behaviors that our respondents reported. And although about 35% reported regularly using 3 or more strategies, most people told us they either didn't use any sun protection behaviors regularly, or they only used 1 or 2 sun protection strategies. And then this graph is showing those 3 sun protection categories that I explained earlier. So again, sun avoidance combined those who said they routinely seek shade, and those who say they don't really go out in the sun for an hour or more. Protective clothing combine those who wear wide-brimmed hats, long sleeve shirts, and or clothing down to the ankles. And sunscreen we kept as its own separate variable. So among women, you can see that sun avoidance was the most frequently reported strategy, whereas among men, protective clothing was most frequently reported. And then this slide is showing the breakdown of the prevalence of sunburn by racial and ethnic groups, and also by age groups. And I think this is really important to show, first of all, just to show that older adults are getting sunburned. So that fact alone makes me think that there's a need for more sun safety efforts targeting this group. You can see that non-Hispanic whites, no surprise, had the highest prevalence of sunburn, as did the younger age groups. The 65 to 69-year-olds and the 70 to 74-year-olds had a higher prevalence compared to some of those older age groups. That being said, we see sunburn prevalent among all of these racial groups and all of these age groups. Now, in the multivariable regression models that we ran, we wanted to look at the association between sunburn and each of these sun protection behaviors, as well as the total number of sun protection behaviors that people were reporting to us. So we found no association between sun avoidance and likelihood of having had a sunburn in the past 12 months, no association between use of protective clothing and sunburn, and no association between the total number of sun protection behaviors and sunburn. However, we did find an association between sunscreen use and sunburn, where those who reported regularly using sunscreen were more likely to have had a sunburn in the past 12 months. This relationship didn't hold, however, once we limited the analyses to sun-sensitive adults. We also included some of those demographic characteristics in our model, and what we found was that males, non-Hispanic whites, and those in the age ranges of 65 to 69 and 70 to 74 were more likely to report sunburn compared to the corresponding other subgroups. That being said, like I mentioned before, and you'll hear me keep reiterating, we did see that sunburn was prevalent among all age groups, all races, all ethnicities. So just because someone is not in one of these high-risk groups doesn't mean that they can't benefit from sun protection messages and generally making sun protection a habit in their day-to-day lives. These findings raise some important questions. So why didn't we find a protective effect for sun protection behaviors, and why was sunscreen use associated with an increased likelihood of sunburn? So this is likely due in part to the limitations of our survey questions. We didn't ask participants exactly what sun protection they were using at their time their sunburns occurred. So we don't have that level of detail about the context in which these reported sunburns were happening. And so that's a limitation, and we realize that, and that probably plays into some of these findings. But these results are likely also reflecting the challenges of maintaining adequate sun protection to avoid a sunburn. So for example, you can imagine someone might routinely wear protective clothing, but still have some unprotected skin that's exposed to the sun. And those relying on shade for protection might find that shade can also have its limitations. So for example, if shade is in an area with a highly reflective surface like sand or water or concrete, the sun's rays will reflect off of that nearby surface and increase total UV exposure. And then sunscreen comes with its own challenges. There's the need to apply it thickly. Oftentimes people aren't applying it thickly enough to cover all exposed skin, including places that we frequently forget, like the back of our neck or our ears. And then there's the need to reapply often. So the recommendation typically is to reapply every 2 hours. And then also if you're swimming or sweating a lot, the sunscreen is going to wear off more quickly and needs to be reapplied even more frequently. So what can we do to promote sun safety among older adults? Certainly, there's an opportunity here for some targeted efforts, considering some of these high-risk groups that we identified in our analyses. So people like men, those in those ages of 65 to 74 years, those with sun-sensitive skin, or those who may be more susceptible to sun damage because of medications they're taking or products they're using on their skin, they might benefit from some targeted approaches, as might those who are frequently outdoors. And this could be people who work outdoors as part of their occupation, and it could also be people who spend a lot of time outdoors for recreational activities. And when we're thinking about recreational activities, it's also helpful to get even more context specific to think about what types of activities they're doing and what sun protection behaviors will be most practical, because there will be times where shade isn't really an option, and this comes into play a lot when someone's in the water, let's say swimming laps at a pool or out at the beach. And there are times when protective clothing has its challenges, or when sunscreen isn't as practical. So we really have to think a little bit more about the context as well to make sure that we're offering some protection strategies that people will actually put into practice in their day-to-day lives and for their specific activities. We know a lot about individual directed strategies that work for younger age groups, and I think this opens up some research questions that could inform efforts to target older adults. So for example, there hasn't been much research in the way of understanding how to best frame sun safety messages for older adults and how to counter this misconception about sun safety not really being of value later in life, that all the damage is kind of already done. How can we empower older adults to take action to protect their future skin health? And given how frequently some older adults interface with the healthcare system, clinical counseling might be an effective strategy and a really practical one to promote sun safety in this age group. We've seen that for younger age groups, clinical counseling is quite effective, and it's recommended by the U.S. Preventive Services Task Force for patients 6 months of age all the way through age 24, particularly those who have fair skin. And really the reason the task force doesn't speak to clinical counseling for older age groups is simply that there hasn't been research to assess whether it's effective in these older age groups. So that's another area where more research could really add to what we know about how to best promote sun safety among older adults. There are a number of community level strategies that have been found to be effective. And again, a lot of the evidence comes from research that's focused on younger age groups like children, parents, and young adults. But a lot of these would likely apply to younger age group, would also apply to older adults. We could just use a little more research in that area. This includes strategic placement of shade in outdoor community settings, addressing some of the financial barriers to sun protection. So for example, we found in some of our other research that those who have a lower household income are less likely to report regular sunscreen use compared to those at higher household incomes. And what we're seeing across the country is in communities, organizations are providing free sunscreen to their community members through these sunscreen dispensers, like at local parks and things like that. And so that's a great way to make it easier for people to use sunscreen if they would like to do so and remove that cost barrier. There are also, like as we're thinking about ways to improve sun protection more generally, you'll also often hear us talk about increasing engagement with various community sectors, that all community sectors can play a role, and we need to think about the ways to engage them. And so my hope is that through our paper and through this webinar, it'll spark some ideas about other community sectors that we could engage in this work to promote healthy sun protection behaviors at every stage of life, including older adulthood. Now, related to that, I did want to briefly highlight some resources that are available, especially for anyone who's listening in and would like to learn more about skin cancer prevention and give some thought to how we might do more to promote sun safety at every stage of life. In 2014, CDC's Division of Cancer Prevention and Control had the opportunity to work really closely with the Office of the Surgeon General to develop the Surgeon General's call to action to prevent skin cancer. And this document served to raise awareness about skin cancer as a major public health concern and provides a roadmap for us moving forward. And it outlines 5 strategic goals for skin cancer prevention in our country. Following that report, each year, our Division of Cancer Prevention and Control at CDC has released a progress report. And in this report, we provide the latest data on melanoma incidence and mortality, sun protection behaviors, use of indoor tanning devices, sunburn, relevant state legislation, community success stories, and more. So we try to make it a one-stop shop for all our latest information on our progress in addressing skin cancer in our country. And this year we'll be releasing the 2019 report, actually later this month. And both the call to action as well as all of our progress reports are available on our CDC website in the link provided on this slide. And then before I wrap up, I also did want to circle back to this supplemental issue of the Gerontologist where this paper was published. I definitely encourage you to check out the other papers in this collection. They touch on so many really innovative topics related to older adult health, including health literacy, age discrimination, financial hardship, natural disasters, and preventive health services. And also as part of this webinar series, Dr. Rima Rudd from Harvard University recently gave a talk on her paper in the supplement about health literacy considerations for cancer prevention. And you can find the archived recording of her webinar on the same GSA webinar webpage where you registered for this one. So I encourage you to go have a listen to that talk too. It was fantastic. And with that, I am going to turn it back over to Judy to facilitate the Q&A portion of the webinar.
Thank you, Dawn. So yes, just a reminder that you can type and send questions using the questions feature in the dashboard, probably on the right-hand side of your screen. We will not be using a raised hand feature today, so please, if you do have a question, be sure to use that questions panel. And another reminder, we are recording this session, so as Dawn referenced with the other program, we'll send you an access link by email once this recording is available as well. Okay, so we've got one question here, Dawn. Are there concerns with sunscreen safety?
Sure, that's a great question given, I'd say, our current media environment. I don't know about others, but I've seen a lot in the news lately about the safety of sunscreens. Just a little background, sunscreens are regulated by the U.S. Food and Drug Administration as over-the-counter drug products. So FDA is working to make sure that the sunscreens that are on our shelves meet certain safety standards. That being said, FDA did release a proposed rule earlier this year, and if that proposed rule is finalized, one of the things it would do is it kind of classifies sunscreens into several categories. There are a couple sunscreen active ingredients, specifically zinc oxide and titanium dioxide, that this proposed rule states as being considered safe and effective. But there are a number of other sunscreen ingredients, many of which are pretty common in the sunscreens on the market today, like oxybenzone and avobenzone, that FDA is proposing to be kind of put into a separate category where they're saying, yes, these sunscreens are effective at preventing sunburns and reducing skin cancer risk when used with other sun protection strategies, but we need more information on their safety. That being said, FDA, if you look at their website, their messaging has been very consistent in that they're encouraging the public to continue using sunscreen as they have been in combination with other sun protection measures. The other reason there's been some media attention around sunscreen safety is that after that proposed rule came out, there was an FDA-led study that was published in JAMA back in May. Basically, it was a small study. They used 24 healthy volunteers who were randomized to use one of 4 commercially available sunscreens. And participants were applying sunscreen to 75% of their body 4 times a day for 4 days. So very high application of sunscreen over the course of 5 days. And blood samples were drawn over time. And what they found is concentrations of the sunscreen active ingredients that exceeded a threshold that FDA has established, where if they had been under that threshold, they could have potentially waived some toxicology studies, but because they were over it, basically FDA is saying there's a need for more studies. So we know, in kind of more plain language, we know that sunscreen is getting absorbed into our bodies and is detectable in our bloodstream if we use it, but we still don't know the full health implications of that. The one thing kind of circling back, I think it's important to remember 2 things. One, that zinc oxide and titanium dioxide have been identified as safe and effective. So consumers can always fall back on checking the label of sunscreens on the shelves and finding ones that are using those ingredients as their active ingredients. And then also remembering that sunscreen is just one of several strategies for sun protection. So it's not something where someone has to be relying on sunscreen alone and always applying lots of sunscreen in order to stay sun safe.
Mm-hmm. Oh, that's good. Thank you. Another question here. Dawn, what is the role of skin cancer screening?
Yeah, so that's an important question, especially as we talk about older adults, because you would think, given how most of the skin cancers are being diagnosed in the older population, that might be the age group that would benefit most from routine screening. At CDC, we look to the U.S. Preventive Services Task Force for guidance on this. And their most recent review of the evidence was done in 2016. And after reviewing the literature, they basically determined that we still don't have enough evidence to assess the balance of the benefits and harms of routine skin cancer screenings for any adults of any age group. That being said, they do note that this is a research gap, so we need more research to further understand the benefits and potential harms of routine screening, and they do note especially for groups that are at highest risk, like older adults. So I think a little more research in that area could go a long way for us to figure out whether that would be a useful strategy for this age group.
Mm-hmm. Thank you. And here's another question. How do older adults get enough vitamin D?
Sure. So whenever we talk about sun protection, I think this question has a tendency to come up because when our skin is exposed to the sun, our bodies do produce vitamin D, but we can also get vitamin D from dietary sources. Some of the best sources include fatty fish like salmon and tuna, cheese, egg yolks. There are a number of food products on the market that are fortified with vitamin D, especially milk and ready-to-eat breakfast cereals. So there are ways to get vitamin D through our diets. The other thing I should mention is that there's so many variables that come into play in determining how much vitamin D our bodies will produce in response to sun exposure. The time of day, the time of year, geographic location, how much cloud cover there is, and then the very unique amount of melanin present in a person's skin. All of that plays into how much vitamin D we would produce. And so it makes it nearly impossible to create some sort of general recommendation about how much sun exposure a person would need to produce enough vitamin D for bone health. So that plus the fact that we know of this strong association between sun exposure and skin cancer risk, most major health organizations recommend just getting most of your vitamin D from your diet. And then if you're concerned about getting enough vitamin D, certainly talk to your doctor. There are supplements available, but you'll want to speak with a healthcare professional about like what dose would be best for you.
Mm-hmm. Super, thank you so much. Well, I don't see any other questions coming through, so I want to thank you so much, Dawn, for today. It's been a real pleasure learning about sun protection and sunburn. And I also want to, yes. Well, and I also want to thank everyone for participating. This is the end of the program.
Thank you, Judy, and thanks everyone for your time.